This segment of Delmarva Life is brought to you by Delmarva Dental Services.
So, you remember yesterday when my partner here so candidly shared with you that our coffee table is basically covered in spit? We had a little fun with that one.
Well, actually, I lied. It's not the coffee table. It's actually the iPad.
It's true.
Wipe them off every once
bad.
in a while.
Yeah.
But on a more serious note, your spit really is important. It's not just something we try to avoid getting covered in at all costs. In fact, it can actually say a lot about your health.
And you may, like us, be wondering how. And for that answer, we turn to Sean Stryker, who's standing by with the pros at Delmarva Dental Services.
Spit, saliva, it's a topic we don't talk about often, but maybe we should, because you can tell a lot about a person's health by looking at their saliva. And I'm here with Dr. Joe Harmon with Delmarva Dental Services. Doctor, thanks for joining me.
Thanks for coming.
All right, so saliva, what is it and where does it come from?
Well, saliva is a biological liquid. Basically, it comes from, we have 6 major salivary glands in the mouth. We have hundreds of minor salivary glands. We have salivary ducts where the saliva comes through. And basically, it helps us to digest food. There's enzymes in it, amylase and lipase, which help us to digest food. It also lubricates. It allows us to not get cut in our mouth when we're eating. It lubricates our teeth. It helps with swallowing. It also has biological antibodies in there that actually, if you cut yourself in the mouth, it heals really quickly. In fact, it heals 5 times faster than the outside if you get a cut on your arm, basically because it has those good antibodies in there.
So it's really important. And your body produces, you were telling me a number, 2 to 4 pints of saliva a day, which sounds like a lot, but it's a really important part of it.
And most of it is in the afternoon, and there's less at night and that's why we wake up with that dry mouth at night, and that's why it's important not to eat sugars before you go to bed at night, because you don't have that saliva neutralizing things.
I know it also helps, keep dentures in place. So the list goes on and on.
Oh yeah, we have a serious problem with people who have dry mouth holding dentures in.
Now, saliva, it actually is kind of it can give you a window into a person's health, and there's a lot of tests that can be done with saliva.
Yeah, we're all familiar with the home testing that we do with saliva, the drug tests that are done to find out about our ancestry. Employers use saliva tests for drug testing, but a lot of the saliva testing we can't do ourselves because we can't interpret them, like hormone testing, testing for different kinds of bacteria in your mouth, testing for if you have pancreatic cancer, that can be done with a saliva test. You can test for fungal infections. You can test for different cancers. You can test for venereal diseases in the mouth. A lot of things you can test with the saliva.
And that has to be done by a professional.
Yeah, mostly it's not the complicated nature of the test itself. It's a very simple test. It's actually the analysis of the test. What do you do when you find out something? That's where you need a professional.
And it is actually really simple. It's a really simple process, and we're going to actually do one here right now on me.
Yep.
All right,
okay.
so let's do it.
Okay, basically what we do is you take this tube and you swish with this mouthwash for 30 seconds. It's on airtight. Okay.
So swish with this.
Swish with that. Swish, swish, swish. Now, another thing that we can test for is their research in their testing for Lyme disease, and not yet, but that's research in the Lyme disease. They're testing on different types of cancers and things like that. What was happening before was we didn't have the sophisticated technology to analyze saliva. And now we have more sophisticated technology will allow us to analyze saliva. Now, the beauty about saliva testing is you don't get stuck with a needle, and it's much more simple now. And because the concentrations are higher in the blood, that's why we did blood testing. But now with sophisticated technology, we can test the saliva.
Spit it in there. That's
Okay,
it.
that's it.
That was painless. A lot easier than the needle.
And basically, we put a preservative in there because we're going to send this off. And then we take this off, and we put this cap on it. And then we label it and send it off to the lab.
That was really simple.
Just like that.
And I can imagine, you visit your dentist 2 times a year at least. Being able to get these tests done more frequently has to be helpful.
Oh, it definitely does. I mean, there's bacteria in your mouth. For instance, if you're not responding, you have gum disease, you're not responding to conventional therapy, there may be a certain type of bacteria that could be hanging around. We use it for implants prior to surgery because we want to make sure that bacteria that's going to cause something to fail is not present. We can also tell your susceptibility to gum disease with a DNA test.
Dr. Harmon, thank you so much. Great information. Saliva testing. If you want to read more about saliva testing or Delmarva Dental Services, all you need to do is head on over to our website, delmarvalife.com. Jimmy and Lisa, hopefully we get those results back soon, and I'll have a clean bill of health.
Well, it really does make sense, doesn't it?
It does. But who'd have thunk?
I don't know. Now we know.
Now we know.
Now we know.
So it was just last month when I visited Delmarva Dental Services in Salisbury, and I took a saliva test after learning your spit can say a lot about your health, Dr. Joe Harmon told us. Saliva tests can determine if a person has different fungal infections, cancer, bacteria, things like that in your mouth that you really don't want in there. Well, the list goes on and on. Well, the results are in.
You ready for this?
No, but I think I have to be, because now there's no turning back, you know, and Dr. Joe Harmon is back with us right now. All right, doctor, lay it on me.
Well, Sean.
He's pregnant, isn't he?
Am I pregnant? That's what I was afraid
You're
of.
not the father.
Okay. That should I be?
But I would say, all joking aside, don't drink after Sean. No, a joke. First of all, we have hundreds of bacteria in our mouth, hundreds of different species. What this test we did for Sean was just designed to test for gum disease. And he had a low risk for gum disease. He did have an interesting capnocytophagia species.
Whoa.
But most
that
people
mean?
have that need their teeth cleaned and have some gingivitis.
So
So
this
that's
is-
not an irreversible damaging bacteria.
And that makes sense because actually I'm due for a cleaning this month. So I go in, hopefully get that taken care of. Not a big deal.
Okay, so
I'm not that concerned about it.
You're all right with it.
Dr. Harmon told me I'm good.
So after a saliva test, what then?
Well, we usually use it for people that have severe gum disease, and we'll give them antibiotics. We'll use it if we're going to do implants, to put them on antibiotics before we do the surgery. If they have an infection, we may do it to determine what kind of antibiotics to use, things like that. We also can use it, like you said, for fungal infections, to test for cancer, HPV virus,
Wow.
things like that.
Okay. Wow.